Welcome to Personal Protective Equipment and Environmental Services, keeping EVS team members, patients, and caregivers safe. You will learn about the basic principles of personal protective equipment and how it plays an important part in protecting hospital staff, including environmental services team members, patients, and family. Your work of cleaning and disinfecting rooms and items is very important for the safety of patients, visitors, and staff. As an EVS technician, you save lives. Sometimes while performing this work, you will come into contact with blood and body fluids, microorganisms, germs, or other potentially dangerous substances or objects, such as sharp objects. You need to protect yourself from these dangers so you can continue to protect patients from infections. Sharp objects that may have been left by clinical staff can be found in the garbage, left in a container, or may be found on the floor. Germs, also known as microorganisms or pathogens, can be found on all surfaces. And chemicals can cause injury to your eyes or irritate the skin if splashed while cleaning. Because of these risks, it is very important to create the safest environment possible for you and those around you. A big part of these safety measures involves wearing the right safety equipment. Most people refer to personal protective equipment as PPE. When you hear PPE, think of special clothing and equipment to wear while you are working, so you are protected against germs or chemicals that can hurt you or make you sick. PPE also helps to stop germs from moving around and spreading infection. The Occupational Health and Safety Administration, OSHA, says that personal protective equipment, or PPE, may include gowns, masks, gloves, safety glasses, and any other protective gear to protect you from germs and chemicals. You will use different types of PPE depending on the job you are doing, and if there are isolation precautions in place for the patient in the room you are cleaning. Wear PPE anytime you clean up blood and bodily fluids, and when you clean a surface or handle linen contaminated with blood or body fluids. You must do this even when the patient in the room you are cleaning is not in isolation. This is called following standard precautions. Consider what Henry says about PPE and safety on the job. Henry has worked as an environmental services technician for the past 12 years. He has worked all throughout the hospital, in many different settings. While training a new staff member, Henry was asked how he could work so long in a place with so many exposure risks. Henry explained to the new staff member that he keeps not only himself, but his coworkers, the patients, and his family safe by getting his flu shot every year, performing hand hygiene, and wearing his PPE correctly, regardless of what others may do. Henry also explained that he tries to remind others, regardless of their role, working as a team keeps everyone safe. Remember, standard precautions are the basic steps you take to help stop the spread of potentially harmful germs that can lead to infection and cause disease. These precautions protect patients, families, healthcare workers, and yourself from infection. There are many different types of PPE for EVS technicians. Goggles or eyewear are worn to protect your eyes when there is a risk of splash from blood, bodily fluids, and chemicals. They are also required when listed on the Chemicals Safety Data Sheet, or SDS. An SDS is provided by the chemical manufacturer. If the SDS is not readily available to you, be sure to ask to see it, especially if you have doubts or concerns about the chemical. Masks protect our nose, mouth, and airways. They are worn by staff when exposed to isolation patients or when working with potentially infectious waste. Goggles and masks are a smart choice when you think there may be the potential for splashes to your eyes and mouth when cleaning up spills of blood and bodily fluids or working with chemicals. Look for the isolation signs posted at the patient's entry point. These will tell you which PPE is required. If the sign is missing and/or PPE is not available and you suspect it is an isolation room, ask your supervisor or the charge nurse if you have any questions. Always ask questions to be sure. Protect yourself. Gloves are used to protect your hands. There are a few different types of gloves we use. These will be covered later in this program. The masks pictured here are called respirators, or sometimes they are called N95. Surgical or regular face masks have a looser fit and don't require special fit testing. They offer some protection from possible splashes or droplets from someone who has flu or is sneezing. Regular masks do not protect you from some types of infection that are spread through the air, such as tuberculosis, TB, or measles. Regular face masks are not considered respiratory protection devices. Let's learn about respirators. Respirators are worn over the mouth and nose to protect you from harmful pathogens in the air. Special filters in respirators catch these microscopic organisms and filter the air so pathogens are not inhaled. A respirator is always put on or donned before entering the room of a patient on airborne isolation precautions, perhaps because they have TB or the measles. A sign on the side of the door to a patient's room will tell you if you need to wear a regular mask or a respirator. If you are not sure, ask your supervisor or ask the nurse responsible for the care of the patient. Gowns or aprons are worn to protect your skin and clothing from possible splashes or contact with pathogens and chemicals. Remember that sometimes you can feel quite warm when wearing gowns or aprons, but they are there to protect you. Please do not remove them until work with that patient has been completed and you are exiting the room. Face shields protect more of your face than regular masks. They cover your mouth, nose, and eyes. They are worn when there is any risk of splashing of body fluids, blood, or chemicals to those areas. Your hands do all your work. Because they are so busy, they are also easily exposed to, carry, and transfer germs. Gloves are worn to protect your hands anytime you are performing your work duties. The gloves you will use in your facility are typically disposable exam gloves, meaning that they are used for a specific time and purpose, must be thrown away after this use, and not reused. You should wear these while cleaning and disinfecting to protect your hands from chemicals and other harmful substances. Use a new pair of gloves for each room. If there is more than one patient in a room, please use a new pair of disposable gloves when cleaning and disinfecting each patient's area, furniture, and bed. Change gloves for each new patient. Discard the gloves after cleaning each room. Never wash disposable gloves. Do not use them from room to room. Avoid touching your face with contaminated gloves. Remember to perform hand hygiene after removing and discarding gloves. It is not enough to use gloves. You must use them correctly. When you use gloves correctly, you go a long way in protecting yourself and those around you. These are the do's and don'ts for you to follow, so you are using gloves correctly. Do not wear gloves between patient rooms. Do not use gloves in the hallways, elevators, or public areas unless they are being used to clean, disinfect, or you need to clean up a spill that is in the hallway outside patient rooms. Change your gloves when moving from a dirty to a clean task. For example, after cleaning and disinfecting the room, you change your gloves before making the bed and restocking the room. The gloves you use at work come in all shapes and sizes. Choosing the right glove for the right task is important. For example, rubber-like, latex or non-latex gloves are used when cleaning and disinfecting, gathering garbage or soiled linen, or when coming into contact with certain chemicals or infectious waste. There are other types of gloves, such as those made to protect you from sharp things, like a scalpel blade. Many laundry workers also wear these when sorting soiled linen. Mesh gloves are often used by food and nutrition services staff to protect hands from knives. Ask your supervisor if you should use a utility glove when handling trash or for other heavy-duty tasks. Please remember that if you are allergic to latex, do not use latex gloves. Talk to your supervisor about what type of glove to use. It is important to be sure to change gloves when they get ripped or torn. The smallest hole or tear can potentially transfer harmful pathogens. Clean hands can stop infections. Hand hygiene should be performed before beginning tasks in the area you are working, before and after contact with the patient or the patient environment, whenever your hands are visibly soiled, between patients' rooms while cleaning the patient environment, after using the bathroom, and before leaving work for breaks, meals, or at the end of the shift. Perform hand hygiene anytime you feel the additional need to. Gloves are not a substitute for hand hygiene. Hand hygiene, which consists of washing hands with soap and water or using alcohol-based hand sanitizer, needs to be performed when entering or exiting a patient room and after glove use. While gloves do not protect you, gloved hands create a warm, moist environment perfect for germs to grow. There are two ways to perform hand hygiene. When cleaning hands with an alcohol-based hand rub, apply product to the palm of one hand and rub hands together, covering all surfaces of hands and fingers until hands are dry. Remember, if you see that your hands are dirty, you need to use soap and water, not alcohol-based hand rub. When washing hands with soap and water, wet hands first with water. Apply the amount of soap recommended by the manufacturer, and rub hands together for at least 15 seconds, covering all surfaces of the hands, thumbs, and fingers. Rinse hands with water. Dry thoroughly with a disposable towel, and use the towel to turn off the faucet. Gloves protect your hands, but you need PPE to protect your skin and clothing, and to prevent germs or microorganisms from moving around. You will wear gowns or aprons to protect your skin and clothing when mixing or pouring chemicals. As with using gloves, you will use gowns or aprons for certain isolation rooms. Follow the instructions on signs posted near the door of the patient room. Some special rooms, such as pharmacy clean rooms and radiation therapy rooms, also require special gowns. These are special rooms that should not be entered without specific training. Contact your supervisor for any questions. Most gowns or aprons are disposable. Use them once and then discard them. Some hospitals may use reusable gowns. Check with your facility or supervisor for proper disposal of gowns and aprons. As seen earlier, there are several types of masks to use for a variety of purposes. Surgical masks are used in surgery, or when entering room of a patient in droplet isolation because patient has flu. The mouth and nose are covered when wearing the mask, and they need to be discarded when leaving the room. The N95 respirator is used before you go into a room of a patient in airborne isolation precaution. These have a tighter fit as a seal is required. Never throw away a respirator. Check with your supervisor or facility about how to dispose of a respirator properly. If your facility requires you to wear a respirator, you must be test fitted every year to make sure the respirator fits tightly to your face. It is important to test every year because any changes, such as losing or gaining weight, can affect the way the mask fits. The required annual fit testing is usually performed by an employee health representative or by a leader in the EVS department. It is also important to check the fit every time you put the respirator on. This is called a fit check. The person who does the fit testing for you will also tell you how to use the respirator and do the fit check. The fit check should be performed before entering the room where you need to wear the respirator. In certain situations, a powered air purifying respirator, commonly known as a PAP-R, may be used in order to provide the right protection. Check with your supervisor or facility if you need a PAP-R. Goggles and face shields are worn to protect eyes from chemicals, body fluids, or other harmful substances. Goggles totally cover the eye area, including top, bottom, and sides. If you wear glasses, do not depend on your glasses alone. Wear the goggles over your glasses. This protection is important when the EVS technician is diluting or dispensing chemical disinfectants. You should know what happened to Alicia, a staff nurse working with a dialysis patient who had hepatitis. When dialysis was finished, she went to pour out the fluid, and the fluid splashed up into her eyes. She thought the eyeglasses she was wearing kept her safe, but she was exposed to hepatitis and had painful burns to both eyes. After extensive testing and treatment for her burns, Alicia was fully recovered, and she never skipped using goggles again. Face shields are made to protect the entire face from potential splashes. Another product that may be used at times are masks with attached face shields. These are good to use with potential splashes in contact isolation rooms. PPE is worn in many situations, including when mixing, diluting, or dispensing chemicals. It is important to pay attention to the Safety Data Sheet, SDS, to know which PPE to use. If you are asked to clean a chemical spill, notify your supervisor immediately to make sure proper protocols are followed and you are not placing yourself at risk. When cleaning blood or body fluid spills, while clinical staff are usually the ones to clean up the bulk of the waste, it is important to use the right protection when disinfecting after the initial cleanup. When entering and cleaning isolation rooms, pay attention to the sign in the entry. If there is no sign but you notice other staff members wearing PPE, do not be afraid to ask if it is an isolation room and remind the nurse an isolation sign should be placed. Wear the appropriate PPE when cleaning special areas, such as the surgical areas or the pharmacy clean room. If no PPE is available, do not enter the room until it is. You will most likely wear gloves, but sometimes, depending on the circumstances or the isolation precautions, you may require also a gown, mask, or respirator. You need to know how to take off or doff correctly the PPE to protect yourself from bodily fluids or contamination that may be present on the PPE. Contact with the outside of the gloves and your skin should always be avoided. Remember, the outside of the PPE can come into contact with harmful germs or chemicals. You need to be trained on how to put on, don, and take off, doff, each piece in the proper order. Don't be afraid to practice with your trainer or educator. You may not have to wear every piece of the PPE provided before entering a room. For standard precautions, typically only gloves or a mask is required. If you need to don all of the PPE, you must don each item in the correct order. To put on PPE, perform hand hygiene first. Then, put the gown on. Tie the gown if ties are present. Next, put on the mask or respirator. Make sure you fit check the respirator. Then, put on your gloves, making sure each glove covers the cuff of the gown. Alcohol-based hand rubs and gels or soap and water are acceptable for hand hygiene before PPE is worn. To remove the PPE, also called doffing, do so slowly and carefully inside the room before leaving it. Remove gloves first because they are most contaminated. Carefully peel the gloves off one at a time and discard in the infectious waste can. Reach up at the neck and untie the gown. Pull the gown by the ties off the shoulders and grab the inside of the gown and pull it off, rolling inside out into a ball, being careful not to touch your clothes with the outside of the gown. Discard into the infectious waste can. Next, remove the mask by only touching the elastic bands and discard. Respirators are removed, doffed, after exiting. Perform hand hygiene and leave the room. Note: check with your supervisor about how you should clean your hands after leaving a room where a patient is in isolation for Clostridium difficile. PPE is important to wear when you need it. It is just as important to take it off correctly when you do not need it. PPE is worn in any environment where protection from exposures is needed. Anytime you are cleaning and disinfecting, come into contact with chemicals or other potential harmful items, or being exposed to patients on special precautions, or you are in special areas. It is not supposed to be worn when walking in the halls or pushing carts or riding in the elevator. PPE works only if it is used consistently and correctly. Taking shortcuts or being careless may place you in danger. Gloves will not protect you from sharps injuries. If you find a sharps device, let the clinic staff know and have them dispose of it safely. Make sure you contact your supervisor and let them know so a report can be completed. Eye protection can protect you from splash injuries to the eyes if worn correctly. Respirators help you by preventing you from breathing in some harmful germs. EVS technicians have an important job. You are saving lives by preventing the spread of harmful pathogens and helping patients to heal in a clean, safe environment. You can protect yourself by wearing PPE correctly and by performing proper hand hygiene. Don and doff the PPE correctly. Wear it only when needed and remove it when you don't. By protecting yourself and staying healthy, you help patients stay safe and get quality care.